If you're feeling unwell or you're unsure, I encourage you to answer a series of questions on the site to determine whether you need further testing or medical attention. We continue
to add important information for Canadians on canada.ca/coronavirus. Yesterday, we added a questionnaire to the main page so that people can see what they need to do based on their symptoms. I encourage you to use and to refer to this tool if you don't feel well or if you feel you may have COVID-19.
More mental health supports accessible online, and we will have new tools up as soon as next week. Our mental health is difficult to maintain with the enormous disruptions that we're seeing in our lives, and we're all searching for ways to hold on to routine and to each other. If you are alone, reach out by phone or online to friends and family and find new ways that you can do things together using technology. Share a meal with friends or family who are apart from you using a social media platform that allows you to see each other. And try to spend time outdoors each day. Social distancing doesn't mean that we have to stay inside, but while you're doing that, give people their space. Stay 6 feet away from others. And as always, be kind. There are people in every community who are struggling and they need our help more than ever. Reach out to them. Even a small gesture, a text, or a call makes a difference. Now more than ever, we need to stay connected. And thankfully, we have tools that can help. Thank you very much. Today, we'll hear from Dr. New on a situational update, and then from Pablo Rodriguez, Minister Rodriguez, on the House of Commons reconvening next week. Dr. New.
Good day. Bonjour. Globally, there are over 318,000 cases of COVID-19 in over 185 countries. In Canada, as of this moment, there are 1,388 cases of COVID-19 and 19 deaths. We have tested over 92,000 people across the provinces and territories. That's over 54,000 additional people tested across Canada over the past 5 days. Looking back at the week behind us, there have been several signals of concern. We have seen steep increases in case counts, cases among healthcare professionals, and in vulnerable people in high-risk settings, like long-term care facilities, tragically including several deaths.
Over the next days and weeks, our biggest challenge will be to continue to apply with determination social distancing while waiting to see the fruits of our efforts. Prevention is a very delicate measure. It takes time before we can see the results. We can't count the number of cases that were avoided through our measures, but we know the measures are necessary. We have seen the devastating effects of this pandemic in the countries that waited too long to put measures in place or that let their guard down too soon. This is why we must continue this to the end. During this period, where many people continue to return from their March breaks outside of Canada, we ask you very strongly to stay home and to self-isolate because there's a high risk that you have been exposed to COVID-19 and that you may transmit the infection to others. In addition, if you are sick, avoid contact with other members of your family.
The biggest challenges will be to maintain our resolve in practicing social distancing while we wait to see the signs that our efforts are having an effect. Prevention is hard work. It takes time to see results, and we can't count the cases we prevented, but we know it must be done. We've seen the devastating effect of this pandemic on countries who have waited too long or let down their guard too soon, so we must see this through. As many people continue to come back from March break travel outside of Canada, you have to stay home and self-isolate due to the increased risk that you have been exposed to COVID-19 and could spread the infection to others. Furthermore, if you are sick, that means avoiding contact with other family members. These days and weeks, for some, have been challenging, and we are in the early days into this difficult effort. It's still too soon to say how much we have affected the trajectory of COVID-19 in Canada, but as Canadians, we will band together and get through this time together. Let's keep up the momentum. Let's get this right. We owe it to ourselves, our families, friends, and neighbors. Merci.
Thank you, Dr. New. And now I'll turn to Minister Rodriguez.
Bonjour à tous. More than a week
Good morning,
ago,
everyone.
members of the House of Commons joined together to do the right thing and adjourn proceedings until April 20. However, we all knew there was a chance that some of us would have to come back for a recall of the House. And since then, our government has taken strong and quick actions to respond to COVID-19. Today, I wrote to the Speaker of the House requesting that he recall the House on Tuesday, March 24th at noon, which he accepted. The purpose of the brief recall is so that the government can introduce legislation to bring in emergency economic measures to support Canadian workers and businesses in response to the COVID-19 pandemic. Aujourd'hui, j'ai écrit au président de la Chambre des communes pour demander le rappel de
Today,
la Chambre.
I wrote to the Speaker of the House of Commons requesting that he recall the House on Tuesday, March 24th at noon, which he accepted. The purpose of the brief recall is so that the government can introduce legislation to bring in emergency economic measures to support Canadian workers and businesses in response to the COVID-19 pandemic.
Canadians are living through an unprecedented crisis that requires swift action by their federal government to ensure that they receive the financial support they urgently need. Les Canadiens sont frappés par une crise sans précédent et c'est pourquoi
Canadians are living through an unprecedented crisis that requires swift action by their federal government to ensure that they receive the financial support they urgently need.
As you know, I've been in discussions with my counterparts from all opposition parties in recent days about this recall. There were good conversations, lots of collaboration. We're all working together in the best interest of Canadians, and I want to thank them for their collaboration. Merci à tous les partis d'opposition.
Thank you to all the opposition parties for their cooperation. The recall of the House will give MPs the opportunity to debate these important measures and get Canadians the immediate support they need.
Here's the plan for what is going to happen on Tuesday. First, there is agreement between all parties that the House sit for only one day. We have all agreed that it's important to have a small number of MPs in the chamber. Our public health officials are reminding us and all Canadians about the importance of social distancing. So we agree that in addition to the Speaker, there will be 32 MPs in the chamber. The numbers will reflect the proportion of MPs from all the parties. As we all know, we are in an emergency and Canadians need help quickly, and this is a fact. On l'a déjà vu dans les derniers jours, la rapidité avec laquelle la
Over the
Chambre
past few days,
et
we
le
saw
Sénat peuvent réagir à
how
des
quickly
situations
the House of Commons and the Senate can react to extraordinary situations by working together in the best interest of Canadians. I would like to thank the opposition parties for their collaboration and say once again that we will face this crisis together as Canadians and we will get through it
And I would like
together.
to thank the opposition for the collaboration and say once again that we will face this crisis together as Canadians and we will get through this together.
Thank you very much, Pablo.
Okay, you know the drill. One question, one follow-up. Rachel Haynes, CTV.
Hello, Rachel Haynes here from CTV. My first question is for Minister Hajdu. When did you first know and first briefed about the coronavirus threat, even when it started in China?
It would be hard for me to precisely give you a date. I can check back and we can give you a date on the first briefing, but it was extremely early January. I would say probably around the 10th or so that I had returned from my own vacation, and I was briefed at that time that Dr. Tam had been observing a cluster of very unusual activity in Wuhan and was quite concerned about what that might represent in terms of future developments.
And Dr. New, there have been a number of concerns about the backlog of results and the cases of community spread. Even here in Ottawa, the public health officer is saying that there could be number up to 1,000 people who are infected right now. How many people right now do you believe are infected with COVID-19?
That's a difficult question. I really can't speculate or conjecture. We do know that our best efforts are being put forward at all levels of government, the federal government, provincial and local, to make sure we get testing available, have access to as many people as possible, because we want to actually have the most accurate picture of what's happening in our communities. So at this point, I don't think it's useful to speculate on how many people might be having COVID-19. We'll base our results and the way forward on the test results, and then put our best foot forward in terms of the public health actions that need to follow.
But if there's the backlog, how
One
can you
follow-up,
know?
please, Rachel. Louis?
I can take a shot at answering that as well. We are not only obviously watching the numbers of new cases, but the numbers of deaths and where those deaths have occurred and in what context they've occurred. So, for example, we know that I think 9 of the deaths that we have, I think it's 9, occurred in one single nursing home in the Vancouver area. That is important to understand because it isn't that we're seeing deaths accelerate in an emergency room. It's not to say that we won't, and that's what we're trying to work so hard to prevent. So when Dr. New is saying it's hard to speculate, it's because the data is different depending on where we are, and the measures that we're taking will actually influence what Dr. Tam has called the attack rate, how many people will actually get sick.
Maybe I can just add to that is that we're pulling out all the stops at all levels of government too in terms of testing technologies, getting access to more test kits and so on. So certainly at the present time, you indicate there might be a backlog. We're working to deal with that.
People not listening to your advice about social distanciation. Police has to intervene. We see pictures on the social media, people filling up parks, don't really seem to care. What's your message to these people? Monsieur Rodriguez, vous voulez ajouter quelque chose en français?
If you want to add something in French,
I had
Mr.
some pretty strong words yesterday, and I would stand by those words. I would say that people need to take this seriously, that various different levels of government have various different quarantine acts and measures that could include up to and including financial monetary penalties and in some cases arrest. And provinces and territories and the federal government will be using the tools that they have to ensure that people comply. What we would like to see, obviously, is Canadians to comply willingly in the spirit of generosity towards their citizens. We understand this is hard for people to understand who are in an area where maybe they don't have even one case yet. But people need to understand that what protects them from having one case is the behaviors they're choosing today. So I mentioned walking outside, and you mentioned being outside in various different settings. We're not saying that people shouldn't go outside unless they are symptomatic. If people are symptomatic, they have to stay in their house and stay in their room and not interact with other healthy people or asymptomatic people. That is all cases, all the time. There is no exceptions. If people are not symptomatic and are feeling fine, it is safe to go outside. But even then, they should be practicing, maybe we should be calling it physical distancing, staying 6 feet away from people, making sure that you're not crowding people. I heard reports of people walking on the seawall, for example, in Vancouver yesterday. But I think every region and every province is having examples of this. This is very serious. And just because you're not feeling the illness or you don't have necessarily in your community even one case, what we're trying to do so diligently together at all levels of government is prevent this disease from spreading towards other communities, and everybody has a part to play in that. So, I will reiterate what I said. It is essential that people are following the advice of public health, and the advice is getting stronger and stronger. And with that stronger advice will becoming more and more penalties if people don't listen.
I would say that if there are still people not taking this seriously, I would say that if you are not taking this seriously for yourself, do it for those who are around you, for those you love. Never in the history of humanity will somebody's behavior have such an impact on those around them. Now, regarding the House reconvening this week to put in place measures that were announced last week, would it have been possible to act sooner, perhaps this weekend even? Is it the way the government works, and what is it? Well, the bill has to be ready. So it did take some time, a certain amount of time, and then the bill must be tabled for the types of measures we're putting in place so that we can put these measures in place as quickly as possible. And that's why I wrote to the Speaker of the House this morning, and he agreed to my request in the minutes that followed, and we're reconvening Tuesday.
You talked about the fact that there could be stricter penalties at a federal level, and right now there seems to be a patchwork across all the provinces. Today, for example, Nova Scotia announcing stricter penalties there. What is it going to take? At what point are we going to see more severe penalties on a federal level, and what would that look like?
Well, I already have at my disposal the Quarantine Act, and we're looking at a number of ways that we can make sure that we have stringent requirements of the Quarantine Act for people who are returning to Canada, for example, from spring break or the snowbirds that are returning. Let me be perfectly clear. We will use every measure in our toolbox at the federal level to ensure compliance. This is of utmost importance, and I will speak directly to those people who are returning to Canada from March break or the snowbirds who are coming back. When we say that you must stay at home for 14 days, that means you stay at home for 14 days, that you do not stop for groceries, that you do not go visit your neighbors or your friends, that you rest in your house for 14 days, no exceptions. If you are returning to a household with other people who have not traveled, then you rest in isolation from those other people. You stay in your room or in a basement or in an isolated area away from the other people in your family. It is critically important, especially for those returning home now, to ensure that they follow this public health advice that we're giving them. And the advice will be not just advice. If we need to take stronger measures, we will.
Specific, you've talked about how you're going to make it more crystal clear for people getting off cruise ships, and like you said, the snowbirds coming back. But I think it's important for them to know what could be coming if they don't take these measures. Like, what specifically are you talking about here?
Under the Federal Quarantine Act, which has jurisdiction over international borders and travel and not necessarily interprovincial travel, we have measures that could include monetary penalties up to and including criminal penalties.
Okay, we'll switch to the phone.
Thank you. Merci. Please press star 1 at this time if you have a question. S'il vous plaît, appuyez sur étoile 1 maintenant pour poser une question. There will be a brief pause while the participant register for questions. Il y aura un court délai vous permettant de vous enregistrer dans la file d'attente pour la période de questions. Thank you for your patience. Merci de patienter. We have a first question from Kristen Doby. Notre première question est de Kristen Doby from the Globe and Mail.
Hi, good afternoon. Minister Rodriguez, could you comment on how the government is reorienting resources, if at all, to deal with the surge in EI applications?
Will be explained during the debate on Tuesday, and of course, things that will be explained in the bill that I cannot talk about at this moment.
The Prime Minister was asked about this at the press conference this morning, but wondering if you can speak at all to other steps the government is considering in response to wage pressures that businesses are facing.
Well, I mean, as you saw with the measures that we presented last week are touching everybody, all Canadians. We said it very clearly. We don't want to leave anybody behind. We have measures to help people that have access to EIs, to measures for people that don't have access to EI, measures for people that have to stay home because they're sick or they have to take care of somebody, as well as measures for small businesses. So this is a first phase, and we've been very clear. This is a first phase to stabilize the situation. It's not even, starting to relaunch the economy. That's going to come after, and we think that these are necessarily and very inclusive steps to help all Canadians. And the details of all of this will be in the bill that will be introduced and debated and adopted on Tuesday.
Okay, next question.
Thank you. Our next question is from Helen Buzetti. Notre prochaine question est de Hélène Buzetti du Devoir.
Oui, bonjour, Monsieur Rodriguez. J'aimerais que vous nous
Hello, Mr. Rodriguez. I'd like you to tell us a little bit about what will happen on Tuesday. First, you haven't given us how many members per party, and you also didn't tell us what will happen on the Senate side. I imagine that they also will have to pass this bill. Will they do so with reduced numbers as well, and what will it look like? In terms of the House of Commons, there will be about 30 members, 14 Liberals, 11 Conservatives, 3 Bloc Québécois members, and 3 members from the NDP.
Alors, c'est un débat ça va durer au total environ.
The debate will last about 4 hours and a half. There will be a question during which people can ask questions, a period rather, during which people can ask questions, but it won't be a regular question period. We want to ensure that the various parties can ask the questions they need to ask, and we'll ensure that there's a minister present to answer the question. And that period will happen around 4.5 hours as convened with the other parties. The next day, the Senate will also be sitting essentially in the same way with a smaller number of senators. We expect that the Senate will do the same thing. What we've heard from them is that they wish to do the same type of work, given the urgency of the work that needs to be done. But looking at how much collaboration there was last week at the House level and at the Senate level, everything should be passed in the Senate the next day with royal assent on the same day. And I mean, it's silly, but you didn't mention the Green Party. Is it a problem to not include them? And more generally speaking, that means that members will have to travel while Mr. Legault is telling us to stay in our regions. Some senators are older. Are these points that were taken into consideration also? Yes, there may be a member of the Green Party. We're waiting for confirmation. We've taken that into account in the numbers, but I just haven't gotten a confirmation yet. Now, in terms of travel, we are prioritizing people who can come to the House by car. So we're trying to avoid long distances. So it will be more ministers and members who are closer to Ottawa. For example, members who could come from Montreal or Toronto by car.
Thank you. Our next question is from Harley Weeks. Notre prochaine question est de Harley Weeks from the Globe and Mail.
Hi, thank you. We've heard a lot of concerns from various provinces about the backlog in tests and shortages of materials. Just wondering, Dr. New, perhaps you can address this. From your perspective, what are the primary challenges with testing shortages, and how soon are they going to be addressed or resolved?
Among the public health community in Canada, and obviously the Special Advisory Committee of which Dr. Tam and myself were part of, that's a very live issue. We're having active discussions. We recognize that obviously there's a global challenge in terms of getting the supplies, materials, the testing kits, and so on. But we're putting our best efforts forward. I'm aware that we are in the process of acquiring additional testing kits. We're also looking at the new testing technologies. We've just obviously, I think, Minister, approved sort of regulatory-wise different testing technologies that we're also looking to validate as soon as possible, and that would also add to the toolbox that provinces and territories can use, and obviously in their jurisdictions. So I can just assure you that we're pulling out all the stops, looking at all of the possible things that we could and should be doing to ensure that Canadians have access to testing. We recognize that's the most important thing we need to do in terms of public health action.
And I'll just add, I want to thank all the lab workers who are working all across the country to try and find innovative ways to speed up the processing of tests. Various labs have various different turnaround times. At the national lab, the turnaround time is only 24 hours, and the lab workers are working full stop to try and process the many tests that we're receiving through the national lab. But part of the challenge is also the logistics of transportation, which we also are working on a solution for. So it's as Dr. New said, a very live issue, and a lot of extremely wise people working on all of the various snags and the logistics to speed up our testing capacity.
Okay, thank you for that. In addition, some number of infectious disease experts have raised concerns with the response in Ontario, specifically singling out the province for its very large backlog now of more than 8,000 tests results are taking up to a week in some cases to come back. And officials there have resisted telling people that there is widespread community transmission of the virus, even though their own numbers show about 40% of cases are now the result of community transmission. I'm wondering if you can please just tell me, perhaps Dr. New and Minister Hajdu, if you want to comment as well, about some of these regional disparities that we're seeing and how you're going to address those. There's a number of people who are concerned.
Well, thank you very much. And the special advisory committee that Dr. Tam and Dr. New work through with their counterparts at the provincial level are having that conversation today, as a matter of fact, how we have some uniform standards around not just testing, but surveillance and data provision all across the country in terms of, and including up to and including public health advice and messaging. This is an area that we're watching very closely over the next couple of days, and we have no hesitation to step in if we need to provide stronger guidance and stronger measures to bring some uniformity across the country. We know that various provinces have various problems and challenges, but also assets and strengths. And what we're trying to do is make sure that as we go into the next week, we have a much more unified approach across the country.
Okay, next question.
Thank you, merci. Our next question is from Daniel Thibault. Notre prochaine question est de Daniel Thibault de Radio-Canada.
Bonjour. My question is for Minister Hajdu. Minister Hajdu, you've mentioned the possibility of criminal penalties earlier and fine at your disposal under the Quarantine Act. Could you be more specific on what type of penalties, the amount of the fine, and can you tell me when in your head you think something like the Emergency Measure Act becomes a tool that you need, becomes a necessary tool?
Well, first of all, I don't have the specific information on the quantum of penalties in terms of a monetary approach. We'll get you that information for your article. In terms of whether or not we're thinking about the Emergencies Measures Act, I believe the Prime Minister was asked this a number of days ago, and he said that all tools are on the table, that we will consider all measures necessary in order to actually get to that point that I just made to the previous questioner around uniformity and Canadians being able to expect the same level of attention, service, and detail no matter where they live. And so, again, the best way to do this is with provincial and territorial collaboration. Dr. Tam is meeting today with the Special Advisory Committee. I know those conversations are happening through the Deputy Prime Minister's office as well. But listen, we will not hesitate to take stronger measures should we need to in order to make two things absolutely crystal clear across this country. One, to keep Canadians' health and safety at the forefront, and two, to figure out a long-term strategy to get us out of this situation. Did you want to add in French, Pablo?
Okay, no follow-up. So 3 more questions.
Non, Monsieur Rodriguez?
Oui, Monsieur
Rodriguez, une question pour vous.
A question for you, Mr. Rodriguez. The House will be reconvening next week. Do you think that's the only time that you're planning to bring back a small number of MPs? Or is there a possibility that you'll have to reconvene before the end of the crisis again? Well, it's impossible to answer that question, Mr. Thibault. That's why in the motion, in the unanimous motion between the parties, we included the possibility to reconvene the House whenever it's necessary to do so. You know, things are changing very quickly. There are people losing their jobs every day. People are diagnosed. There are people we are asking to stay home. Others must take care of their children. So that's why we want to be there for all of those people. We are meeting Tuesday to put in place measures that will do a lot. It's not we may need to reconvene the House, but we're not planning to at this moment. Thank you. 3 more questions from the phone line, please.
Thank you. Our next question is from Catherine Lévesque. Notre prochaine question est de Catherine Lévesque de la presse canadienne.
Oui, bonjour à tous.
Hello, everyone. My question was for Dr. New or Mr. Rodriguez. I'd like a comment on what Minister Hajdu said regarding uniform action across the country. We know that the provinces are taking stricter measures to ensure people aren't leaving their homes or gathering. What can we expect over the next few days or weeks at the federal level to enforce that?
Merci pour la question. Je peux parler seulement de.
Thank you for this question. I can only talk about things from my point of view. As a doctor in the public health sector, this is a live issue. As Minister Hajdu stated, even the Special Advisory Committee is holding teleconferences almost every day, even today. We are always in discussions to make sure we have a science-based approach that is based on the available facts as well. We want to provide the best possible advice to the Minister from a public health point of view. All the social distancing measures and other measures that we can consider are part of our discussion. After that, we provide advice to the Deputy Minister and the Minister for their consideration.
D'accord, merci.
Thank you.
I'm going to ask my next question to Minister Hajdu in English. Obviously, vocabulary is very important in times of crisis. And the Prime Minister said he's asking Canadians to stay home and to maintain a social distance. I want to know, are you asking or recommending or are you ordering Canadians to stay home or stay at a social distance?
Asking them and recommending them, and I am hoping that we don't have to get to ordering them.
All right, next question.
Thank you. Our next question is from Sharon Kirky. Notre prochaine question est de Sharon Kirky from the National Post.
Hi, thanks so much. Minister Hajdu, you've mentioned several times now, and you've been asked this, you're prepared to use every measure in your toolbox to ensure compliance. What exactly for you would be the tipping point for stronger measures?
I think the work that Dr. Tam and Dr. New are doing, along with the Deputy Prime Minister, with the various premiers of the provinces and territories, is very important right now. This is, I think, for me, a critical point in the way that we're dealing with COVID-19. And I think for me, should we not be able to get consensus, that would indicate to us that we need stronger measures. And so the work that they are doing right now with provinces and territories around trying to align our actions with public health evidence, with the goals, as I said earlier, of keeping people healthy, keeping people out of the hospital, but also finding a way out that includes a robust testing strategy based on the best science and evidence that we have, looking at ways that we can make sure that provinces and territories have what they need in a surge. Those are all very important conversations. And I hope that they are successful, because I think for me, should we see a reluctance on behalf of the country to pull together, that would be a time where we would require additional measures.
And sorry, my follow-up, there's sort of this small but growing chorus from contrarians who are calling overkill. They're saying that the data collected so far on how many people are infected and how the epidemic is evolving, some are saying are, quote, utterly unreliable. The former Chief Medical Officer of Health for Ontario this morning actually sort of echoed those calls and said that what we're taking are steps that are really unnecessary, and what we should be doing is, for example, isolating seniors, anyone, say, 50 or 60 and older, and allowing younger people to sort of continue on their ways. Could I get your response to those concerns?
I'll start, and then I'll turn it over to Dr. New for the science. But I will say that it is not anecdotal evidence that we are using to make our decisions. It is science, and it is details from other countries, and it is reports from people like I've mentioned before, the Minister of Health from Italy, who is in the crisis of obviously their country's lifetime, with hospitals that are now making decisions about who will live and die based on kinds of metrics that we can't even imagine in Canada. It is the reports from New York physicians in emergency rooms who are saying it is not just old people that need to be severely and medically supported, that there are a high degree of young, middle-aged, working-age people that are requiring significant medical interventions to get through this crisis. So I would say that we have some of the best scientists in the world in our government. We're very fortunate to have two of them with us here at the federal level, Dr. New and Dr. Tam. We have been increasingly alarmed as we've watched this sweep around the globe. And I would say that it is our obligation as politicians to take this seriously and listen to our scientists. So with that, I will turn to Dr. New.
I just have an additional comment. Certainly, we live in a free and democratic society, and everyone's entitled to their opinion. But all I can say is that the overwhelming majority of the public health community, our colleagues who are working right now, and the healthcare community, we're all on the same page. This is a serious issue. We need to deal with it right now.
Okay, last question.
Thank you. Once again, please press star 1 if you have a question. De nouveau, n'hésitez pas à appuyer sur étoile 1 pour toute question. And our next question is from David Lundgren from the Reuters, Ottawa.
Yes, good afternoon. I have a question, Dr. New, but I will admit right away that this is a question born of medical ignorance. I gather the Canadian tests, you apply a swab and then you have to go and analyze the nasal secretions, and this can take several days for a result to come back. I'm seeing mentions in media elsewhere of other countries who have supposedly put together tests that give results in a matter of hours. Is that the case? Am I confusing two different procedures here?
No, you've hit it right on the head. The test that we're using right now in Canada, obviously, based on having the genetic sequence, is what we call a PCR-based test. It does involve, as you said, with a swab and then sending it for a result. The turnaround time, as Minister Hajdu has said, is that in our National Microbiology Laboratory, it takes 1 day, about 24 hours. Having said that, certainly we're aware of other testing technologies. I think we've mentioned that. We've had regulatory approval for these new testing technologies, which can give results quicker in a matter of hours instead of a day or so. And so certainly we're looking to acquire these new types of testing kits and to obviously roll it out across the country as soon as possible.
And when you noted a jump in the number of tests you've done over the last 24 hours, but is that the number of tests you've done, or did you actually get results from the samples you took?
These are test results, so I think that's also quite remarkable in terms of the fact that, as I just mentioned at the top, we've done over 92,000 people have been tested across the country, and even over the last 5 days, that's more than 10,000 test results per day, and so I think it shows that we're reaching Canadians. Canadians have access to the testing, and for the most part, they're good results because you look at it. Obviously, we have 1,388. Positive results so far, but that also, if you do the math, subtract that from 92,000, that's quite a number of negative tests.